Lebron Ioane Betaya, Honorable Prime Minister Fiame Naomi Mataafa, thank you very much for keynote address. Honorable Minister of Health, Barasi Ruapito Kanua, Bongamanga Tapto Sere, Director General of the Ministry of Health, Leausa Toria for Dr. Take Nasser. Members of diplomatic corps and development partners, distinguished guests, ladies and gentlemen, Talofa Lava. I am delighted to see that 112,000 doses of vaccines arrived at Apia from Japan through COVAX Facility. On behalf of the government of Japan, I'd like to express our profound respect to the government of Samoa for its best efforts of the vaccine rollout for the people of Samoa, and to extend our heartfelt appreciation to the COVAX and United Nations organizations such as the UNICEF and the WHO for their coordination on these vaccines. Japan has been supporting Samoa government's fight with the COVID-19 pandemic through assistance of various medical equipment, including cold chain supply. I would also like to highly appreciate Australian government's great contribution of 15 million doses of vaccines to neighbor island countries. I will continuously build this kind of collaboration with development partners such as Australia and New Zealand to promote the cooperation for Pacific Island countries. Now, I hope to highlight that these vaccines are the first case of our assistance realized by Japan's new Pacific Bond Kizuna policy. The policy was pledged at the 9th Pacific Island Leaders Meeting, or PALM-9, held last month between Japan and Pacific Island Forum member countries. After PALM-9, leaders of Pacific Island countries emphasized the importance of cooperating to promote early access to safe and effective COVID-19 vaccines, strengthen healthcare systems of island countries, and support an economic recovery from the pandemic. In order to respond to the voice of island countries, Japan pledged its Pacific Bond Kizuna policy based on our vision of free and open Indo-Pacific. Through Kizuna policy, Japan will further strengthen its cooperation with Pacific Island countries to tackle with various global agenda. Tui ole COVID-19. Whawhetai lava soi wha.
Honourable Prime Minister Fiame Naomi Mataafa, Honourable Minister of Health, Director General of the Ministry of Health, CEOs, dignitaries, members of the Diplomatic Corps, friends and colleagues. What a great occasion. Talofa lava. Australia is absolutely committed to supporting comprehensive coverage of vaccines in the Pacific and Timor-Leste. And we're very grateful today to see the delivery of the doses from Japan, 112,000 doses. So thank you very much to my good colleague from Japan. So far, Australia has committed to 15 million doses for the Pacific and Timor-Leste to ensure that our friends and neighbours in the Pacific receive that vaccine coverage, because we know that without vaccines, we won't be able to beat COVID-19. And we know that we're feeling it at home at the moment. So it's really great. And I congratulate Samoa, both the Ministry of Health, for the fantastic work you've done so far in the vaccine rollout, and also to the people of Samoa who have taken it up with such enthusiasm. That will make a big difference for Samoa and for the region. We're really pleased that so far we've been able to get 1.6 million doses to the Pacific and Timor-Leste, and we were very happy that Australia was able to fill a critical gap in the vaccine rollout to maintain momentum for Samoa with 50,000 doses over the last couple of months. Of course, it's not just about vaccines. Australia is incredibly pleased to be able to provide support beyond vaccines, and that includes funding for the Tamanu app, an Australian-developed electronic patient record system that will account for vaccines administered. And it's really exciting to see how that Tamanu app has been used by the Ministry of Health. It's really enabled some fantastic numbers to be shown for the districts, including in Savai'i, which is really great to see those numbers increasing. We've also been pleased to provide Australian-funded advice, technical advice on vaccine safety and research, and funding also to improve water, sanitation, hygiene and waste management at district hospitals. This all builds on support through the COVAX AMC, where Australia has committed 130 million Australian dollars. We will continue to work in partnership with our Pacific family in responding to the pandemic. Whaafatai lava.
Yeah, Lausunga Whawhenga, Honourable Prime Minister, Honourable Minister for Health, Director General of Health and your ministry, all other CEOs present, Diplomatic Corps, ladies and gentlemen. Firstly, my name is Ayao Tatuau Lima Manuia, Silvi Inga Malfaftai Liatua. Let me also say congratulations to the health sector and the Ministry of Health for the excellent effort on deployment of the vaccination throughout the country. New Zealand is a long-term partner of health, of the health sector, and obviously through the current vaccination process, we've been able to assist through funding to the COVAX Facility that deploys vaccines to Pacific Island countries, including Samoa. And as mentioned earlier, New Zealand is also committed to providing funding assistance and support to hopefully deployment of the Pfizer vaccine later this year for all our under 12 to under 18. Yeah, now Paulus on time. I left our long way I don't fight out that. But anyways, put a look for it too, and yeah, if I just may be in the name of Fengamaro, I miss it. Therefore, now when I tell him the deployment of vaccine in the Samoa, Mutanat Samoa, so if home,
Thank you so much, Reverend Minister of the Church, Honorable Prime Minister Fiame Naomi Matafa, Honorable Minister of Health Balasi Tonamanga Tafito, distinguished representatives of the Government Director General Dr. Take Naseri. It is indeed with great pleasure and gratitude that we join today our development partners and the government of Samoa in marking this conclusion of the procurement of vaccines for Samoa. We are equally grateful to the government of Japan, represented here by His Excellency Ambassador Jonoki Terasawa, to the government of Australia, represented by High Commissioner Honorable Emily Luck, to all of the other partners here who have made possible the COVAX facility. And I would like to put on the record that together with Australia and Japan, we also have New Zealand, we have the United States, the United Kingdom, in no order, the government of China, who have put resources into the COVAX as well as transfer of vaccines using the same mechanism. We wouldn't be able to mark this success today without the great work that has been put into enrolling in the COVAX facility early on. So Samoa was one of the very few countries at the beginning to have completed the formalities to join the COVAX facility. It was in December, on 18th of December, when the first deadline had to be met. and then in January continuing with all the formalities to be able to receive 79,200 vaccines through the advanced market commitment arrangements. Just for everyone here, 92 countries within the COVAX received vaccines, up to 20% of the population, 2 shots, without making a financial contribution. And this was because official development assistance provided by all of our partners enabled the transfer of vaccines at no cost, again, the 20% share. So a lot of work that has come into this process. I'm also equally thankful to the United Nations team here and to WHO and UNICEF colleagues who have assisted and continue to assist the government of Samoa in ensuring the full and successful completion of the vaccination program. Vaccination and access to healthcare represent a fundamental human right. We have marked this progress that the country has made into the Universal Periodic Review, UNCT report, United Nations report, that will be reviewed at the 3rd UPR, Universal Periodic Review in Geneva in November. I also want to share with you all that the success of the COVAX facility, that again brought in contributions of our traditional donors as well as of non-traditional donors, may be replicated moving forward in addressing other challenges. And one of them that will be soon discussed is climate change. So similar mechanisms that would allow all countries to have access to finance, to have access to technology, to have access to means that are necessary to address the global warming challenge may draw lessons from the COVAX. I will close by saying that the United Nations has started the development of its new 5-year cooperation framework. This is a very intense consultative exercise. We are conducting now the common country analysis, and we will soon be able to engage with the government, with the civil society, the private sector to discuss the new priorities. We believe that health remains among key areas in which Samoa would benefit from support from partners, from the United Nations, and the United Nations supported by you all, distinguished representatives of the diplomatic corps here, and beyond the diplomatic corps here also by the European Union and other partners. And we look forward to ensuring that routine vaccination will be fully completed in this country, so all children will have full exercise of their right to immunization. And then COVID will remain somewhere outside, far away from Samoa. We also hope and pray for other countries in the region and other countries around the world to be able to address this massive health challenge that COVID-19 still remains. Whawhetai te lava soifua.